Welcome back to another episode of Health Insurance Unraveled. My name is Travis Stallman. I'm your host today. I'm a licensed Medicare broker based out of Wisconsin. Today we are going to do our Monday Q&As. So we got three common questions that I have received over the course of my time working as an inside telesales agent as well as a Medicare broker. I'm out in the general public working for multiple carriers. So let's begin. Today we're going to focus on scams, Medicare IDs, and why I actually upload these videos to YouTube and to my Facebook business page. So to begin with here, we got scams. One of the most common questions I have been getting, especially coming off of the annual enrollment period of October through December, is hey, I'm getting a lot of mailers. I'm getting a lot of phone calls. How do I know what's a scam? How do I know what is legitimate? Why should I talk to you? You're calling me. I've never had your number pop up in my phone before. Uh, I got a mailer from you. How do I know this is legitimate? So as far as scams go, CMS, which is the Center for Medicaid and Medicare Services, they have cracked down quite a bit on regulations that brokers, such as myself, we have to follow. So, for an example, if you receive a phone call, whether you make a call out to a broker such as myself, or if let's say I got your information on a business reply card where you requested me to reach back out to you, there is a new regulation that states that I have to read a disclaimer to you within the first 60 seconds of the call. That disclaimer basically indicates that who I am. I'm a Medicare broker, that I don't offer every plan available in your service area. You can always contact Medicare.gov or 1-800 Medicare to explore all plan options in your area. That is not the exact wording of that disclaimer. However, that disclaimer does need to be read to you on the phone if you are talking to a agent or a broker in the field and not calling directly into, let's say, like Humana, United Healthcare, Anthem, Network Health, whoever it is that you're talking to. You need to get that disclaimer read to you. So once again, a way to avoid phone scams, specifically on the phone, is if you receive a phone call from somebody and you're like, I don't know if this is legitimate or not, and they're not directly from a specific insurance company, and they do not read that disclaimer to you within the first 60 seconds or first 2 minutes of the call, potentially that could be a scam call. So keep that in mind. Once again, that disclaimer, I will have a exact copy of the wording of that disclaimer in the description link below. So if you do want to make a mental note of that to avoid potential scam calls in the future, that is something to keep in mind. As well as, let's say, okay, well, Travis, I like to meet people face to face. How do I know if this is a scam if I meet somebody face to face versus, the disclaimer over the phone? Well, face to face, as a broker, we have to have what's known as a scope of appointment or SOA filled out. Basically, what that scope of appointment is it's the insurance policy for myself, the broker, as well as yourself, the beneficiary of Medicare or whatever insurance it is that you're going through. Specifically for Medicare, we're going to focus on today. We have to fill out a scope of appointment. Got to hold on to that for 10 years. Basically, what that is it's documentation, whether it be physical or digital documentation that says, hey, I'm meeting with XYZ broker. In this case, say you're meeting with myself. I'm meeting with Travis Dahlman on this date. We are going to discuss Medicare supplement policies with prescription drug policies or Medicare Advantage policies. We met at this location, and then we need your signature as the beneficiary on that scope of appointment, as well as my signature as the agent or the broker. So a scope of appointment is for face to face, as well as you do need to have one of those filled out over the phone. So a phone, you have the disclaimer that's read within the first 60 seconds, as well as you also get a scope of appointment filled out. The scope of appointment typically over the phone, you're going to receive that electronically, whether that be a text message, you sign your name via text message, or you can receive an email link typically. As face-to-face scope of appointment, I like to use physical copies so I can keep those in my filing cabinet, easier for me to maintain those records. So scope of appointment, the disclaimer recording, those are two ways to prevent scams. So if you ever received a phone call and you feel like, hey, this is not legitimate, in the description below, Under this video, there will also be the phone number to report any potential scam calls that you feel weren't legitimate, so that we can get those scammers taken off the streets. So we're going to move on to Medicare ID. What is a Medicare ID? How does it work? How has it changed previously? The big change here is the Medicare ID number, or MBI, which is Medicare Beneficiary Identification Number. That used to be your Social Security number with the letter A or the letter B after it. Um, they changed that, I want to say 2018, 2019, somewhere in there, to a combination of numbers and letters. It helps prevent fraud and scams. So basically, you should have received, if you already had a Medicare card prior to this change, you should have received a new Medicare card that no longer says your Social Security number on it. It's going to have a new number. It's going to have a combination of numbers and letters. There are ways to potentially look up your new Medicare number if you call into certain insurance carriers using a Social Security number. However, that is frowned upon in most cases. So they will typically ask you for your new Medicare ID number. So if you have not received your new Medicare ID number, you can contact 1-800-MEDICARE, 1-800-772-1213. That's a good number to reach out to potentially get a new Medicare ID card. When you get your new ID card, it's going to have a new number on there. That new number will be a combination of numbers and letters for those people who still are using their old Medicare card that had their Social Security number. Once again, this is to help prevent frauds, prevent scams, identity theft, and so forth. So once again, if you have not received your new Medicare ID card, or if you're still using your old Medicare ID card, please reach out to myself, reach out to your broker, reach out to Medicare, Medicare.gov, 100 Medicare, to get a new ID card ordered up. It's going to make your life easier, prevent any type of potential scams, identity theft, and fraud going forward. The last thing here is I've been receiving a lot of questions. Why do you make these YouTube videos? What's the purpose of them? Are you trying to make money off of them? What is why? So to be completely blunt with you, I'm making these basically to make sure that I can spread as much Medicare knowledge, as much health insurance marketplace, Medicaid knowledge available out there. I have talked to so many people that I've sat down, either at their kitchen table or talked to them on the phone, and they're just like, "Well, I didn't know. I didn't know that this was available. I didn't know that I only had to pay my Part B premium if I go with an Advantage policy. I thought I had to pay $300 for a supplement. I didn't know. I didn't know that, hey, a supplement might be a better fit for me because I do a lot of traveling. I didn't know. So my purpose in making these YouTube videos is to help eliminate that I didn't know. There's been cases personally from family members that they got duped by Medicare or health insurance brokers, or different insurance agencies out there, where they're like, hey, this policy is a great fit for you. That individual gets sick, and now, your family's stuck with a multi-thousand-dollar hospital bill or medical bill. So the reason why I make these YouTube videos is to get as much information out there in the general public as possible. It's not to be famous. It's not to, help build, my personal book of business, which has, is classified as like my clients. It's just to help you, the general public. So that's the reason why I always say, if you have a broker, if you have an agent, you have somebody you trust, with your health insurance information, reach out to them. I'm always here, for you, but you should always reach out to who you trust with your health insurance. I'm not here to tell you that this plan is better than that plan. I am here to answer any questions you have in general. I used to do, green screen backgrounds. I used to have digital pop-ups that popped up, all around me, and I wanted to, break it down, be a little bit more authentic. I could go back to, making myself look good, look pretty, but I want this to be as authentic as possible. I am here for you to answer your questions. I'm not here to be in a suit and a tie to, feed you some, lines of BS. To be frank with you, health insurance can be complicated at times. My goal is to unravel that and make it as less complicated as possible. So if you ever have any questions, if you have a topic you would like me to cover, throw it in the chat, throw it in the comment section. reach out to myself. My information's on my YouTube About page. Reach out to my business page on Facebook. I'm here for you 7 days a week. Any questions you got? That's all I got for today. So I thank you for watching this edition of Monday Q&A. This has been Health Insurance Unraveled. I've been your host, Travis Dahlman. Have a wonderful day.